Can you think of one of the more annoying things about being a female? Well, while it is wonderful, I'm sure you can think of a few. But I have one in mind that we're going to talk about today, and that is urinary tract infections. Specifically, I want to talk about recurrent urinary tract infections in women in midlife and menopause, and how we can use vaginal estrogen, local estrogen that you use in the vagina, to help prevent your recurrent urinary tract infections. In this video, I'm going to give you 3 big reasons why it's actually really deleterious for your health for you to have recurrent urinary tract infections. And I'm going to talk about why vaginal estrogen is actually a really phenomenal treatment, really safe and very effective. For those of you that don't know me, I'm Dr. Heather Hirsch. Welcome to my channel, Health by Heather Hirsch. I am so excited to see this channel and this community really grow. Thank you so much for your support. It is just beyond exciting because I really truly have a mission to improve the gaps in care in women's health at midlife and in menopause, of which we all know are exuberant. I am the lead physician of the Menopause and Midlife Clinic at the Brigham and Women's Hospital, where I work, and I would love to see you for a consult if you live in the Northeast, and I can also do telemedicine in certain states. It's always evolving, and that has a lot to do with the outside environment. So if you want to see me in my clinic, I will drop the number below. You can call that there to see if you're eligible to see me in clinic. Or if you can't see me in clinic, but you really want my advice, I really highly encourage you to take a look through my course, The Complete Guide to Menopause. Now, I created this course so that I could almost recreate the environment where you sit down with me in the clinic and we talk one-on-one about all things menopause, lab work, to making the diagnosis, to lots and lots of stuff, getting really deep into treatment options, sleep, weight, hair, everything. You can check that out in the link below. If you're not ready for that, please check out my podcast, Women's Health by Heather Hirsch. New episodes come out every Wednesday, and I also have a free hormone health guide that you should definitely download so you can get a jump start on your personalized journey through menopause. If you haven't already done so, please subscribe to my channel so you don't miss any new videos that come out every Friday. Okay, so first things first, we're going to get into definitions. So what is a urinary tract infection? Well, by the textbook, it's not just pain with urination. In fact, that can come from a lot of things, and we call that a non-culture positive episode of dysuria. Dysuria is a medical term for pain with urination. So signs and symptoms of a urinary tract infection are pain with urination, irritation, burning, or just sort of low-grade fever, pain in the lower pelvis, oftentimes after intercourse, and that is because women have a very short urethra. That short urethra means that bacteria can climb through really easily and get to the bladder where they can cause an infection. Now, to have a true infection, not just what you think is an infection, you need to go to your lab and have your doctor write a prescription for you to get a urine culture. When you get a urine culture, they see how many colonies of bacteria are growing in that specimen, and if it is over 100,000 colonies, that is classified as a urinary tract infection. Now, why so high? Well, it's normal to have bacteria in our urine. It's absolutely just normal. We have bacteria and yeast in our vaginas and in our guts, and that shouldn't come as a surprise to you at this point. But it's only considered a clinical urinary tract infection if you have or grow over 100,000 colonies in your urine. Then usually the lab will also run some tests to see which antibiotics are the most effective to the bacterial strain that you actually have. And that's really important because I am going to touch upon antibiotics coming up when I talk about the 3 reasons why recurrent urinary tract infections are really troublesome. Now, what makes it recurrent is if you have more than 3 per calendar year or more than 3 in 12 months. Now, I would certainly argue even having 1 or 2 a year is really disruptive, but it's considered recurrent urinary tract infections if you have more than 3 in a year And remember, you really want to have those cultures proving, you want that proof, the proof is in the pudding, that each of those times there was greater than 100,000 colonies of bacteria, therefore really cinching that diagnosis of recurrent urinary tract infection. Now again, it's really important to actually see this in your urine, because if you are having episodes of dysuria, that pain with urination or what feels like a urinary tract infection, but it's not actually a urinary tract infection when they look at those numbers of bacteria, that's important too, because I want to come back to that at the end of how you can treat then solve that problem. And we don't want you to use antibiotics when you don't need them. So what are the 3 reasons why I don't want you to have recurrent urinary tract infections, or why they're problematic for your health in general? Well, obviously, number 1 is it's an infection. That means that you've got to, have a day or two where maybe you're taking time off from work or taking time off from your other duties. You have to seek medical care. You have to go to the doctor. You have to go to the lab and drop off a specimen. And that just worries you. Oftentimes, that also means you have to take a treatment plan or alter your life in some way. And if you have to do this multiple times a year, that can be really invasive to your overall quality of life and your health goals. Number 2, we don't want you to have to take a ton of recurrent doses of antibiotics. Antibiotics, as you know, are not the best thing. Certainly, we're so happy that we have antibiotics for modern medicine, but repetitive courses is when there becomes some problems. Certainly, the biggest and the one that you probably know about is growing resistance. If you grow resistance to those antibiotics, you need stronger and stronger and stronger antibiotics, and you need modern medicine to make sure that they're making those kinds of antibiotics to treat the bacterial infections. It's because the bacteria continue to get smarter, and as they get smarter, we need to get smarter and adapt. So if you have to take antibiotics frequently, that means that you're really prone to be resistant to some of the more commonly used antibiotics, and you're going to need higher strength of those antibiotics. Also, antibiotics can kill your gut microbiome. They can certainly cause yeast infections or overgrowth of other things like yeast in your gut and the vagina, cause yeast infections and etc. And on you go in a vicious cycle, especially creating good flora in the gut and in the vagina. Especially important for women in midlife and in menopause, but arguably throughout the whole life reproductive course of a woman. And the 3rd reason why is that while this is more rare, what's really dangerous is a urinary tract infection that gets into your bloodstream that can cause serious adverse events and even death. And this is called Urosepsis. Now, I don't want to worry you. This is really, really rare, but usually this is a case of a urinary tract infection that has been brewing for too long, has not been treated, maybe has a very resistant strain of antibiotics, is common in people who have stasis in the bladder or have to do self-catheterizations or dialysis, or they're very complex and sick. You can end up in the intensive care unit, and of course, that's a very dangerous situation to begin with. Now that one, of course, is very severe, but certainly I don't want to see any of my patients with that really intense disease called urosepsis. Now in this video, I'm talking about how you can treat recurrent urinary tract infections with local vaginal estrogen. And this is so important because so many patients and clinicians miss this. Now, the American Urological Association found that vaginal estrogen prevents recurrent urinary tract infections. This is really good news because vaginal estrogen is really safe and effective. A while back, I did a whole video on vaginal estrogen, which I'll post up here. And again, I want to remind you that vaginal estrogen is local, kind of like hand cream. You're going to put it in the vagina and it's really just going to stay there, and it's not going to travel systemically. Therefore, it doesn't carry the same risks that systemic hormone therapy does. However, if you are interested in systemic hormone therapy, that can also help. And I'll link a video here I did on the safety and efficacy of systemic hormone therapy. But back to those local vaginal estrogens. Now, again, if you recall, I talked in that last video, if you hadn't seen it, definitely go check it out, about genitourinary symptom of menopause. So genitourinary syndrome of menopause, or GSM for short, is what we used to call vulvovaginal atrophy. The reason we changed the name is really important in this video because it's not just the vagina that goes through changes postmenopausally and at perimenopause as well, but it's also the urethra, the labia, the clitoris, the bladder. All of those things change in both pH and their functionality and their structure, which can lead to worsening in recurrent urinary tract infection diagnosis or prognosis. So vaginal estrogen is really, really important because it does many things in the vagina. First and foremost, it resets that pH. That pH helps to create a harmony, a very nice environment for bacteria and yeast and all the other things in our vagina to live in happiness. And that really helps to keep the balance good so that you don't get a recurrent urinary tract infection. It also does the same thing to the pH of our urethra, which again, that's that little tube that bacteria climb up to get to the bladder. Of course, keeping the vagina healthy is also good as well because that's sometimes where you get that ascending infection, or where they kind of come from, and then they climb the mountain and they go upwards to your bladder. Not only that, but it keeps the cellular layer healthy. So premenopausally, when we have estrogen, it keeps the cellular layer nice and fluffy and elastic, and it makes these cells that make lubrication and moisture and all the things that, again, help with the pH, but also just help with the integrity of the tissue. And the estrogen is going to help to restore that, which is really, really important. Again, not just for sexual health, because a lot of times we talk about vaginal estrogen for sexual health, but also for the urethra and the bladder. And again, vaginal estrogen has been shown to prevent recurrent urinary tract infections. So this is huge. Again, I really want to reinforce that the safety of vaginal estrogen is really, really good. In fact, long-term studies have shown no increased risk of vaginal estrogen to breast cancer, recurrence of breast cancer for my breast cancer survivors who do use vaginal estrogen, heart disease, strokes, clots, and any of the things that you actually will see on the black box warning that it comes with. Yes, I just said it was safe, but there's a black box warning. Now, listen, many of us menopause experts, both at NAMS, the North American Menopause Society, and several other organizations have tried to petition the FDA to remove the black box warning on vaginal estrogens. Again, because of the numerous studies showing how safe it is. However, that black box warning is probably not going to be removed, but I always counsel my patients to let them know that it's going to be there and to simply just ignore it and put it aside. That black box warning actually is something that came from the Women's Health Study that relays the results of the original 2002 results of the Women's Health Study that was a study looking at oral Prempro. So it has actually nothing to do with vaginal estrogen. Now, which estrogen products can you use to prevent recurrent urinary tract infections? Well, really any that are on the market. So again, these are either estradiol or conjugated equine estrogens. Those are the generic names, but the brand names for that conjugated equine estrogen is known as Premarin, and those brand names are things like Uvafem, Vagifem, Invixi, and there's also something called the E-string, which again is something you can leave in the vagina for 3 months and take out. All of those are going to help tremendously to improve and prevent recurrent urinary tract infections. Now again, don't forget I mentioned, what about women who have dysuria or pain with intercourse but actually are not found to have recurrent urinary tract infections on their cultures? Well, vaginal estrogen is also extremely helpful. The reason that a lot of women will have that dysuria, that pain, or that irritation with urination is because, again, there's atrophy of the urethra, there's atrophy where that urine actually comes out, and when we treat that, we heal that tissue with vaginal estrogen, so many times that tissue can get better. For that as well, there's another oral medication called ospemifene, or its brand name is Osphena, which is oral, and that can help again with the pH of the vagina, and that can also help with a lot of those symptoms. So you have a lot of options there. Again, I want to remind you guys, if you can't see me in clinic, look at the menopause.org website. Now, menopause.org is the website for the North American Menopause Society. That is the governing body of all evidence-based menopause education here in the United States, and I'm excited to be a part of NAMS. You can search under Find a Provider and you can find a doctor that way. I know a lot of you reach out to me for that question, and that is how you do it. Remember, if you want to take a deep dive on all things menopause, I have a whole lesson on genital urinary syndrome of menopause and sexual health that accompanies those vaginal changes, and you can check that out in my course, The Complete Guide to Menopause. The first lesson is free, so you can check it out down there. Thank you guys so much for subscribing to Health by Heather Hirsch here on my little corner on YouTube. I am so excited to see this continue to grow in numbers and strength and community. You guys really inspire me to want to make the time to make videos for you every week. Don't forget to subscribe so you don't miss my Friday videos, and I'll see you guys again next week. See ya. Thank you so much for watching. Bye, everyone.